For people who don't know Blane Shatkin, you're missing out. He's very charismatic. He's always smiling, and he has great credentials. So we welcome you to the show, Dr. Shatkin.
Well, thank you. It's
Why
always
don't-
wonderful to talk with you about the different subjects. I know today we wanted to kind of hit on some hyperbaric oxygen therapy and the indications.
Yes, but can we also let everybody know what else you do? Because, really, I knew you first as a plastic surgeon.
Right. Well, I'm a board-certified plastic surgeon, but I'm also boarded in wound care and hyperbaric medicine. Half the time I run my cosmetic practice in West End, and the other half of the time I've been running the wound care center at Memorial Hospital Pembroke, and actually we just had our 18th anniversary that we've been open. So we've been healing wounds for 18 years and saving limbs and doing great stuff. So it's always nice to have that kind of variety in my practice.
Of course, and when people are listening, these aren't wounds that you get a burn on the stove so much. It's more that you're dealing with diabetics and you're dealing with severe wound healing, aren't you?
Oh yeah, most of our problems are chronic wounds that are, most of the patients have had these wounds for usually a minimum of at least a month, but sometimes of 6 months. Sometimes we see patients that have wounds for 20 years that have never healed. So we really deal with, approach these patients, with evidence-based medicine, and we used a lot of advanced wound technologies, which include, hyperbaric oxygen.
Dr.
Today,
Shatkin, but
go
wait,
ahead.
let me ask you a question. Why don't wounds heal?
Well, wounds wind up in a chronic state a lot of times. I mean, the chronic wounds. So when it's associated with diabetes and venous insufficiency or arterial disease, the state is a chronic state. So what happens is the wounds just stall. They don't heal normally. If we look at it at a cellular level, most of the time when we cut ourselves, there's a whole inflammatory response, and that aids in healing. And actually, people wind up with not the right inflammatory cells for healing. They get all the bad cells, and they wind up being chronic. So when we see these wounds, the idea is to stimulate them so that the good inflammatory cells get back into the wound and start healing. So what I'd like to do, if you don't mind, Anita, is talk a little bit about radiation injury, because we're happy that we have the hyperbaric chambers here for patients. And the one thing that a lot of patients and even radiation oncologists, they're starting to learn how good hyperbaric oxygen can be to help reverse some of the damage that's done with the radiation. When somebody presents with a cancer, say to the head and neck, somewhere, maybe a throat cancer, even a breast cancer, and they require radiation therapy, it kills the cancer, but it also can cause a lot of scar tissue. So the scarring is long term. When we sustain a burn, like you were talking about a stove burn, that heals, but a radiation burn can worsen the life of the patient. It can continue to get bad even though you're not getting the therapy anymore. You might be cancer free, but you might still have problems with the area. So we see a lot of patients that, for instance, in the head and neck, that if they need dental work, their bone is prone to infection, the jawbone. So, Medicare approves the treatment, and a lot of times we treat patients before and after they have their teeth pulled, say if you have a bad tooth, because that's also one of the downfalls of radiation to the head and neck is that it ruins your teeth. So a lot of these people need their teeth pulled, and they wind up with these chronic bone infections. And just with a simple protocol, usually 20 treatments before the tooth is pulled, 10 after, they can heal and not have the known complications associated with the radiation injury. So I know it kind of sounds very complicated, but what is going on is the oxygen is then, getting better blood supply to the area that's scarred in so that you can then heal. And we're seeing a lot of breast cancer patients. And I think that I really wanted to get the word out there because I will tell you that in our community, lumpectomies are very popular for breast cancer. And when you have a lumpectomy, that usually goes hand in hand with radiation injury. So, once a lot of times these patients will present with no breast cancer 6 months later and an open wound on their breast that doesn't heal. Well, so we treat them with hyperbaric oxygen and we get them to heal.
Well, I am so really happy that the success. I think you said that you've been the center is celebrating what you said 18 years.
Yes.
And I told you this in one of our other conversations that I was aware of hyperbaric oxygen therapy when there was a man who really felt it could do a lot of things, even more so than what you're doing, but that it was so obvious is that oxygen is everything to heal wounds. And the fact now that your center is really so successful says a lot about something that probably 30 years ago, people just didn't believe it.
Oh, yeah. Hyperbaric oxygen went through a period in our history where it was being used for everything. The common cold. And so, it became, like voodoo medicine. And anyone could do it. There were little shops that were opening up with these chambers. And the medical field, basically outlawed it. It was gone. And then it kind of had a resurgence. The Navy, obviously it never went away for treating, divers who got the bends. That physiology of hyperbaric oxygen was well known in the armed services, especially the Navy. Especially in commercial diving, it actually. People were using hyperbaric chambers even when the Brooklyn Bridge was being built because these guys were going under and going back and forth under the water with pressure and whatnot, and they were treating them in hyperbaric chambers even back then. So it's come a long way, but now we're really scrutinized by medicine, and so we follow very strict Medicare guidelines for who we treat. We get calls all the time to treat patients that have cerebral palsy and brain injury, and there's a lot of research now being done with traumatic brain injury, especially in the armed services.
Right.
But a lot of that information is not out yet. Oh, and even football players.
Right.
We're treating more football players than ever with hyperbaric. Some of them are buying their own chambers. But, the thing is, the research, we don't want to do off-label use. So we are following Medicare guidelines at this point, and I'm sure things will change. And as we get more research being done, it'll be used for different types of injuries. But we've always, when I got board certified in hyperbaric medicine, they think of oxygen as a drug, and using the pressure to dissolve more oxygen in the blood for different patients. So it's an interesting concept, and there's a lot of things we treat, but we don't treat everybody because, again, we want to make sure we're following Medicare guidelines.
My guest is Dr. Blane Shatkin, and he is the medical director at Memorial Hospital in Pembroke Center for Wound Healing and Hyperbaric Oxygen. He also is a plastic surgeon, and he's a board-certified plastic surgeon, and he has his office and practices in Weston. So let me tell you, and I'm Anita Finley, and I'm so glad that you're listening to this show. I think if even one time that something happens to you, and you know it now because the radio show was worth everybody's time. But Dr. Shatkin, so let's get back we'll peek out of the little window here for a minute. So the fact you are a plastic surgeon, do you find that maybe your patients would do a little better if they had some hyperbaric oxygen?
Well, I will tell you that facelift patients When you're raising skin flaps and say there's, problem with blood supply, I mean, there's a lot of patients that we don't do facelifts on, like smokers, because the risk of lack of blood supply to the skin. Of course, you don't blood supply to the skin, you're going to have a scar and not look so pretty. So there are some patients that we combine it with. It's just an expensive modality. Hopefully, I would say 99% of patients who have plastic surgery do not need hyperbaric oxygen. There's a low percentage that might need a little bit to help them heal. I mean, it would always work. It helps a lot of things, and it could be done. It's just a very expensive modality to help, like, say, get rid of a little inflammation and swelling.
Okay.
But there are some doctors who are starting to incorporate that into their practice. Most of them do not do true hyperbaric oxygen therapy. When you go and you have a chamber and you're taking it, we take it to 2 atmospheres of pressure, which is a very high pressure of oxygen. Then you have to really meet all types of fire hazard requirements, and you have to be, extremely cautious. It's just, you just can't put a chamber in your office without making sure it's wired properly and having, all the inspections that are needed. But they make these chambers you can buy on the internet that are low pressure, they're kind of blow-up chambers. And so some doctors get them, and they, kind of advertise it as a modality that helps their patients heal, but it's not really true hyperbaric oxygen.
Okay, well, let's get serious then, and let's talk about people who you see, and I know you do what we call limb salvage. Tell us about that.
Well, basically, in diabetics or for people who have peripheral arterial disease, that's lack of blood flow going into the foot, and about 30 to 40% of diabetics will have peripheral arterial disease, are at risk of losing their feet and getting wounds that don't heal. We always tell diabetics, make sure you examine your feet. You change your socks frequently, and because all you need is a little needle or a little scratch on your bottom of your foot, and all of a sudden you can have a wound that can take off, and the next thing you know, you have a bone infection, and then you're requiring an amputation. So we try to get these patients in early. We work them up completely. We take, we examine the patient very holistically. We want to make sure their diabetes is under control, that they're not putting pressure on their feet, especially when they have a wound. And then we use all kinds of modalities to get them to heal. And one of them, of course, is hyperbaric oxygen. But from a Medicare guideline, it's about treating the patient first with standard of care. We don't just jump to the most expensive modality. And if we can shrink that wound or ulcer 50% in 4 weeks, then we're making progress, and we're going to get them to heal without the oxygen. But if we don't, if we hit that 4-week mark and they're not 50% closed, then we move on to hyperbaric oxygen. So that helps to save the limb, and it's extremely, obviously, when we save a limb, we always say we save a limb, save a life, and that's because 50% of people who have an amputation will die in 5 years. I mean, there's a very strong statistic involved with wounds involving the feet, especially with diabetes.
So when my mother passed away at 94, but for I think for probably a couple of years, she was when she was so homebound and she was sitting in a chair too much, even though she was moved and all, she wound up with a bed sore on her lower back, and it took a year to heal it without going through hyperbaric oxygen. Could we have done that?
Well, you could have done it, but really not Medicare approved for that. One of the a chronic osteomyelitis or bone infection, if the pressure sore involved the bone and it didn't heal with routine therapy like IV antibiotics, then she would meet the criteria for hyperbaric oxygen, because bone infection is another indication for hyperbaric oxygen from a Medicare standpoint, but it has to be chronic. a chronic problem. But say she had it and she had 6 months of IV antibiotics, didn't get better, then we would treat her in the chamber.
All right. And so would someone be calling you directly, or is this a referral from their primary care physician? How does it work?
Either or. It depends on the patient's insurance. If the patient has an HMO, then they need a referral. Some HMOs nowadays don't need referrals, so it gets a little more complicated. But if they're straight Medicare or they have a PPO, then they don't need a referral. They can just call our number, which you have, but I'll give it anyway. It's 954-883-8014. And Margarita will take your call. She's wonderful. And, if you want to see me, obviously you can ask for Dr. Shatkin, but we have about 8 panel physicians, two of which are podiatrists. We have some general surgeons on the panel as well. And we have someone from internal medicine, and we also have an ER doctor. So we have a very diverse panel. We do not want to steal you away from your primary doctor. All we want to do is communicate with your primary doctor and get the wounds to heal for our patients. And, we didn't mention, but, we've had 90 to 95% healing rates over 10 years now. And we heal wounds generally. Most of our wounds are healed within 32 days of seeing them.
How often does someone have to go into the chamber?
Well, that's a low percentage of patients. Usually we can heal them with standard of care. But the sicker the patient, the more we push to get them in there, especially, again, to save their limbs. And we are one of the few limb salvage centers in South Florida, and we know the indications for it. So, we get the vascular surgeons, we try to get better blood supply to the foot, and if that's not working, then they go into the chamber. So, but we have 2 chambers. I think we're in the process of getting a third. So, there's room here for our patients, and I think they'll be very happy here. The nurses are fabulous. The medical staff here at Memorial Pembroke is outrageous. It's first rate.
So I'm going to ask you a funny question because you have such a great personality. So let's say someone's having a problem and they go into hyperbaric oxygen therapy. Their brain also is being fed a lot of oxygen. Are they going to be able to remember better?
I don't know. If they are, then I need to go in there. No, I'm kidding. You know what? It's some people say that they feel better. Some people say they feel a little tired during the treatment. But I think generally speaking, when you're getting better oxygen to the brain, of course, you're going to feel better and be able to think a little bit better. So there's not a lot of studies out there about it, but when you go into that chamber and we put you under the pressure that we do, it's about 1,000-fold increase of oxygen in the bloodstream, and that's going into your brain as well.
Wow, you see, maybe we're discovering something. A lot of medical treatments have side effects.
Yeah, it could be a treatment for Alzheimer's or something, or brain injury for sure in the future. And I think there's a lot of studies, but the problem is getting good studies and getting approval, from a Medicare standpoint, because one treatment could run, like with the hospital fees and everything, could run about $1,000 a treatment. So it's a lot of money to be paying out of your pocket for.
Do you remember when there were oxygen bars?
Yeah. I think they still exist,
Do they?
actually. I always laughed at those because I thought, this is interesting.
Right.
People are just putting,
right.
oxygen to their nose and breathing it in. I don't know if that's doing too much for them, but that they went in and out, right? The oxygen bars.
That's right.
But hyperbaric oxygen is here to stay, I think.
Yeah.
But again, like I said, we want to follow the guidelines so that we don't get into this
Sure.
feeling where we're trying to use it for everything.
Yeah, I understand. And I think what you're doing, though, you are using it for everything that has to do with it, though. It isn't just, when I see diabetes,
really
poor circulation, right,
Yes.
pressure, burns, trauma, vascular conditions. a lot of things. So,
there's a lot of things that are approved. There's about 15 to 18 diagnoses that are approved, and so you just have to meet certain criteria. I know today we talked really about diabetes. We talked about cancer patients with radiation injury, and again, arterial disease patients who need bypasses to their feet. They could be a candidate after their bypass to possibly get oxygen to heal a wound on their foot. In Florida, that guideline has to be after a major bypass to the foot. So there are certain guidelines that we have to look at. So it's a very interesting topic, and I hope your fans have learned a little bit today. And I'm hoping that if they have any chronic wounds or problems, and their doctors aren't referring them to us, that they speak up, because a lot of wound patients do get the runaround, with their primary doctors.
Mm-hmm.
I think that in this day and age, they're ignored and they're kind of pushed to the side, or I'll see you in a month kind of thing, and they're really not addressing the whole patient and the wound like we do at a wound healing center.
Well, especially now that so much money and so much effort has been put into this, it should be very important for doctors. So that's what our consumers who listen to the radio show should know. And if you feel like you have a wound and it's not healing, you either call, and let me give you an 800 number. It's 866-784-1542. No matter where you live, you can go there. It's Memorial Hospital and Pembroke Center down in Pembroke Pines for wound healing and hyperbaric oxygen. They're located at 7800 Sheridan Street. My guest is Dr. Blane Shatkin, and he certainly is very conscientious. He's very passionate about this, as probably with everything he does. But the phone number again is 1-866-784-1542. One thing we didn't discuss is how about children? Do you find that you ever get any children coming into those hyperbaric oxygen centers?
Well, I'm one of the few plastic surgeons who do see children for wounds. And most children heal beautifully, thank God. I think that there has been some gossip or some things about brain injury with children. Say a near drowning victim might get some oxygen therapy to benefit them. Again, a lot of the research isn't in yet on that, so we don't push it. And we only have single-person chambers, so it's really hard to put a young child in. They'd have to actually go in with their parent. That would be more for a multi-place chamber where actually the parent could go in with the child. And I think they have a multi-place chamber down at University of Miami. But we have mono-place chambers where it's just for one person. But children usually do well, and unless you catch a near drowning victim very fast and they're stable, I'm not exactly sure it's going to really be beneficial.
But there's juvenile.
To the brain.
Well, there's juvenile diabetes, though. So what about those kind of children?
Diabetic, and they wind up with a wound. Of course, we treat them, but we don't see a lot of juvenile diabetics with wounds.
Really?
Believe it or not, we see them as they get older, because that's the manifestation as they get older. Generally, when they're younger, it's just they're just controlling their sugars, and they don't necessarily have wounds. At least we haven't seen them here at our center. We do see a population of juvenile diabetics, but they're probably already in their 30s by the time they develop a wound, or a lot of them have already had amputations, which is a shame. So as time goes on, we should see more of them, actually, because I think if we get involved early enough, hopefully we will prevent them from going on to amputation.
I think it's education. Believe it or not, they're just people who don't know much about this, and that's why it's really so admirable of you to come on, talk about this in the way that you do, and for Memorial to have this. Are there other hospitals in South Florida that have the kind of centers that you have?
There's centers popping up all over South Florida. We've probably been around the longest. Like I said, we've been doing this for 18 years now. So But they exist. There's some to the north of us. There's some to the south of us. But of course, I'm a little biased when it comes to our center.
Well, it sounds like you have a lot of personnel, though. This isn't a casual, just get one in and let's see what happens. It looks like you've really proven yourselves and all. Well, just before we have to go, and we still have just a little bit of time, what's the history of why they did open down there? Was it a particular physician that had this in his or her mind?
Well, no, it was actually the Memorial Healthcare System decided that they wanted a center. The administrator that was here at the time, and he approached me as a plastic surgeon, and I was very excited about it. And so I've been their medical director since its inception. And I think it's, part of the success is obviously having an enthusiastic medical director that's very active. And I see patients here at the center 3.5 days a week, and I see somewhere between 400 visits, 400 and 500 visits a month, easily.
Wait a minute, that's a lot. Are you kidding? 400 to 500
we see a lot of patients. Yeah, and today I'll probably see about 25 to 30 patients in my half day here. So we're very busy, but we take good care of the patients, and we're here to help.
That's hard to really believe. So, do you have support groups?
There are support groups out there. There was a support group for diabetic lower extremity wounds. It's called SALSAL, but there's been some issues with that in South Florida. So I'm not sure what has happened to that, but that's called Save a Limb, Save a Life, where diabetics can be part of it with physicians, and there were meetings, but recently there was a problem with that organization. So hopefully a new one will pop up.
Right, because it's pretty serious when someone says, well, you're going to have to lose your limb. But anyway, we've run out of time, but Dr. Shatkin, this was wonderful. Thank you for taking your time, and my goodness, you have 25 patients to see today. That's really... I can't even breathe when I hear that.
Yeah, well, I need a cup of coffee.
Right, go get a cup of coffee. Okay, thank you, Dr. Shatkin.
All right, well, thank
Great.
you, Anita. I appreciate everything, and we'll be in touch. Okay?
Absolutely.
Take care.